ahead and get started. Thanks, y'all, for joining on a Monday evening. I appreciate your time. My name is Ezra. I use they and he pronouns, and we are going to talk about LGBTQ plus healthcare discrimination. And so first, to tell you a little bit about me, I am the Director of Education and Outreach at FreeState. In the past, I have been a member of Baltimore City's LGBTQ plus Commission, also a content developer with Trans Tech Social Enterprises, which is a company that looks to help trans folks get jobs in the tech industry. And very importantly for right now, as my dog is right over here, I am a dog dad. His name's Mango. He's 2.5 years old. He is a Chihuahua mix. I love him to death. Unfortunately, he also can bark sometimes. He's very touchy. He barked during a meeting earlier today when the mail person came. That was very fun and loud for everyone. So I do apologize if he does decide to do that. I will try to mute myself as fast as possible. And I will let Mackenzie introduce herself.
Hey everyone, I'm Mackenzie Dadswell. I'm a staff attorney with FreeState Justice. I've been with FreeState a little bit over a year now. I came up from Virginia where I worked as a public defender for a while. I do not have any pets, but hopefully that will be changing in the near future and I'll be able to make this slide a little bit more exciting.
Yay, join the club. Love it. All right. So the first little bit here, we're going to go over stuff if y'all didn't attend the last session we had, which was, I believe, in March. It's kind of wild, but it's already been that long. Feels like time is flying. So we might go over some things you heard last time, but it's just so everyone gets up to speed. So in case you don't know about FreeState, we are a legal advocacy nonprofit organization in Maryland. We currently have an office in Baltimore, Maryland, but we are a statewide organization. What you see here are what I would call the 3 pillars of our work. We're probably most known for the first one here, direct legal services. And so that is going to be on a variety of matters relating to someone's sexual orientation and or gender identity. So you see some examples on there. Such as helping folks change their name and or gender marker, discrimination due to LGBTQ plus status, a variety of healthcare discrimination and insurance help, family law, really anything that is a civil matter that arises out of a person's LGBTQ plus status, we're going to help with that. In terms of the work that I have done as somebody who is not an attorney on staff, I do a lot more of the 2 other pillars here. So I do a lot of advocacy and outreach. You will see us in Annapolis during legislative session, advocating for various policies. And as I always talk about, because this year has been particularly interesting, being all virtual, that has been a whirlwind, just as busy as it always is, maybe even a little more. But we were doing a lot of that during session. Partnering with organizations such as the Howard County Library System. We are so thankful for them for allowing us to come and talk for multiple times. So we appreciate y'all. And of course, putting on events like this so we can tell people about various things, whether it's laws, know your rights information, best practices, a little bit of all of it, which is kind of what today is. You name it, we do it. So that's a little bit about us. And so now I'm going to pass it back over to Mackenzie to talk a little bit of a terminology review if you were in the last webinar.
Yeah, so if you missed the last webinar, this is just a quick section on some of the terminology that we're going to be using throughout the presentation. And for anyone who may have been there, it may just be a good refresher. So Ezra, I don't think I have slide control. If you want to take us, oh, thank you. So the first term that we're going to go over is birth sex. This is sometimes also assigned sex at birth or assigned gender at birth. This is basically what it says on the tin. This is when someone's born, typically speaking, doctor's going to look between their legs. make a call as to whether they're going to put an M or an F on the birth certificate. That's your birth sex or assigned sex at birth. Gender identity is, on the other hand, going to be someone's internal sense of being male or female, or outside of the binary on the gender spectrum. So gender identity can be binary, like male or female, or it can be non-binary, agender, genderqueer, bigender, or whatever someone feels. Now, typically speaking, the word that we use for people whose gender identity does not match their assigned gender at birth is going to be transgender. Something to keep in mind, trans, which is the typical short term for transgender, is an adjective. So think of it the same way that you would the word tall. You wouldn't use tall woman as a single word. You would just say tall space woman. Same thing with trans space woman, trans space man. A cisgender person then is going to be someone whose assigned sex at birth does match their sex assigned at birth. So that's when people say they don't have a gender identity or anything like that. Typically what they mean is their gender identity matches their assigned gender at birth and they're cisgender. And I've already mentioned this a little bit earlier, but non-binary is a person whose gender is not exclusively male or female, which means they can identify between the two. They can identify outside of the binary, or having more than one gender identity.
And I will say just really quickly that this is rapid fire. So if any of y'all have any questions on any of these terms or others that we don't cover, feel free to put it in the chat or the Q&A portion.
We could probably do an entire presentation just on the terminology if we wanted to. This is just the background information for this one. And so the last few terms that we'll be using through here is gender expansive is, actually I'll do gender expression first, gender expression is how a person communicates their gender identity to others, and that can be anything from clothing or hairstyle or mannerisms or just how they interact with other people. A person's gender expression does not have to match their gender identity or their gender identity. And when someone falls into or outside of those preconceived categories, we often will say that they're gender expansive. Probably the most recognizable example of that would be a woman who might describe herself as butch. And that is separate from someone's sexual orientation. So even though that's typically used to indicate that a woman is a lesbian, those don't always have to go hand in hand. Someone's sexual orientation is who the person is emotionally, physically, and or romantically attracted to. So kind of what I mentioned, sexual orientation and gender identity are not the same thing. A person's gender identity, sexual orientation, and gender expression are all individual to that person and don't have to fall within preconceived notions. And I'm also doing this slide. For transgender individuals, many transgender individuals undergo what we typically call gender transition, which is the process of going from presenting as the gender they were assigned at birth and that they were probably told growing up that they are, to at some point realizing they're transgender and taking some form of action to start living in alignment with their gender identity. That process is different for everyone. It can include things like getting their name legally changed. It can involve using different pronouns, wearing different clothing, wearing different types of accessories. Some people may start wearing makeup. Some people may stop wearing makeup. People can also change their legal IDs and get different gender markers. We in Maryland offer on your driver's license an MF or an X. And there may also be medical transition involved in that as well, with hormones or even potentially surgeries down the line. It's different for everyone. Different people have different goals and what they want to achieve. Sometimes people have different financial abilities in what they can achieve. And so it's important to respect everyone regardless of where they are on the gender spectrum or where they are within their transition. And I think with that, I'm passing it back to Ezra to give us some statistics about healthcare.
Yes, it is me. We basically went through and wanted to give you all at least a few big resources so that y'all can take some time, and we'll make sure that y'all have the slides at some point so you can see the resources directly without having to Google them on your own. But just to get a snapshot of what the issues actually are when we're talking about LGBTQ plus healthcare discrimination. And so even though Maryland is not in the South, although some people may argue with you and say that Maryland is a part of the South, they were not included in this survey in particular. But we thought this one is really important to put in here because of it being more recent than the other ones that are that do cover Maryland. And so this is called the Southern LGBTQ Health Survey from 2019. This is just a sampling of some of the results from that resource. And you see the source at the bottom there as well. Honestly, if you just simply Google it, the PDF will pull up with the full report. But again, we'll make sure you have this. And so you can kind of see different pie charts here, kind of breaking down the different questions of how people answered this online survey. And so that first one, figure 5A, says, I am comfortable seeking medical care within my community. And that's the total sample overall. You'll see about 26-ish% of folks said always comfortable seeking medical care. And you can also see often, it's about 26% as well. So that's about, over half of folks saying most of the time they are comfortable seeking medical care, which is positive. However, you'll see that there also is a decent portion that is still not comfortable seeking medical care. And so what's interesting in this survey is that they break it down. They'll have ones that are about the total sample, and then they'll break it down by either sexuality or they'll break it down by gender. And you can start to see the different disparities or the differences that exist within the LGBTQ plus community. And so another example down here, figure 5B, it says, I am comfortable seeking medical care within my community by sexuality. That's one example of how they broke it down. And you'll see how folks who, are pansexual or queer, the always category is significantly less than other sexualities. So that's something that I think is really relevant and important for us to think about in terms of who is, feeling comfortable accessing care. And then you'll see a couple other figures here. You see, do you feel your healthcare needs are being met? 47-ish% say yes, about 40% say somewhat, and then still about 13% saying no, flat out. And then finally, the last figure on here says, my experience with physical health providers has been positive in the total sample overall. And you see always is about 19%, often is 45%. Then you have the sometimes, which is a pretty big portion of folks, almost 29%. And then some folks saying rarely or never as well. And there's a lot more interesting things in this survey, including things like this. And the reason why we wanted to share these negative experiences, and don't worry, we have some positive ones later on as well, so that it's not all terrible, is because it kind of gives us an idea of what exactly the experiences LGBTQ plus people are facing when they try to access healthcare more concretely from actual examples. I think the more examples we can have, the better it is and easier it is to understand. And so just to read a few of these. And so one person talked about going to see a doctor 2 years ago that ignored what they were telling him and refused to prescribe the meds I needed. That was a local doctor, and now why I drive 130 miles to my current doctor. And so this is something that FreeState, we actually did a needs assessment back in, I believe, 2016. where a lot of people were saying the same things. So unfortunately, this is still something that is pretty relevant to many folks. So for example, I know I've talked to clients in the past that live out in, for example, Carroll County, maybe even farther out west, such as Allegheny or Garrett County. And they have decided to drive to, for example, Baltimore, or some even all the way to DC. Some will drive to Columbia, Maryland, just to get some provider that is, advertises as, for example, trans affirming and will prescribe hormones. And so that still is something that is relevant, that is still happening to this day. You see a nurse said that nurse refused to draw blood for an HIV test. Medical doctor refused to listen about complaints, refusing to use somebody's name, and only using incorrect terms to describe them. A lot of this is still happening. Again, this is why this survey is important, is because it's from 2019. It really does represent the things that are still happening, even though we have made a lot of great progress as well. And so the survey that we had used in the past as more of the, probably the first one we shared is the US Trans Survey. And that was done in about 2015 by the National Center for Transgender Equality, which is a national nonprofit located in DC. And the reason why we share it a lot is because it is the largest study done in the US of trans people. And so it's a lot of really, really important data in there. Of course, it's starting to get dated because, believe it or not, 2015 is already 6 years ago, which is very disturbing for me to think about. And so that's why it got demoted in a sense to the second one to share, but it's still incredibly relevant for how much it has in there. And so for trans and non-binary folks in particular, it talks about, these are two examples of the full report, which covers more than just healthcare. There's housing, employment, criminal justice. There are a lot of different things in there. So definitely recommend you check it out if you haven't already. And so in this one here, you see some negative experiences when seeing a healthcare provider in the past year, and then it's broken down by different types of negative experiences that have happened. And so the top one right there is they had to teach their healthcare provider about trans people in general to get appropriate care. And that's nearly a quarter of respondents. And I know for me personally, I have had to do this in the past few years with a provider I've gone to as well. So again, it's still relevant, even though this survey is 6 years old at this point. These are still things that we're hearing from our clients as well. Another thing that I want to point out, you might have heard of the phrase broken arm syndrome. And so kind of what that's referring to is that you go in for example, for something like a broken arm or whatever, and instead you get treated for other things that you didn't actually come in there for. And so actually, again, this did happen to me a few years ago in the area. So after 2015, I believe it's 2017 or 2018. And I had gone to an urgent care for what I believed was an ear infection, just based on my symptoms. And of course, looking it up on WebMD, that was the most logical answer. And so I went there and, I ended up listing that testosterone is one of the prescriptions that I take. And so the doctor was reiterating that with me. And I said, yes, that is something I take. And then it became essentially an interrogation of why I'm taking that. Maybe that's causing my symptoms. Maybe I don't actually, just basically blaming everything about me being trans or taking testosterone on why I may be having ear pain at that moment. And that is still, again, that is still something that it happens quite frequently. And it's still something that for trans and non-binary folks, both in Maryland and globally, have had to deal with when trying to just access basic care for non-trans related things. And so we wanted to make sure to share that as well, so that you know that experience. And so you also see negative action or policy by health insurer over there as well. And you'll see denied coverage for transition-related surgery. Over half of respondents who made a request said that this has had it happen to them. And, while laws in Maryland especially, and a lot of other places are getting better in terms of covering more transition-related care, sometimes there's still a bit of confusion, even with policies that do cover transition-related care of, a lot of denials and then having the person actually have to appeal them, even though it is in fact covered. So still a lot of mess, as you honestly kind of expect sometimes from health insurance in general. It's never a fun process, I don't think, for anyone, but it's still relevant today. And so now I'm going to pass it back over to Mackenzie so she can talk a little bit about current laws and policies.
Yeah, so let's talk about kind of the current state of the US and Maryland healthcare laws specifically. So on this first slide that we have, this is a general map that we got from the, I believe, Equality.
This is Movement Advancement Project.
Movement Advancement.
Yeah.
Sorry, the HTTP was a little small. So this is a general map that just kind of gives a broad overview as to the current state of the laws in the United States, state by state. Until we get some type of act passed at the federal level ensuring LGBT protections in medical insurance, which doesn't look like it's going to be happening anytime soon. The laws are very dependent on which state a person's living in as to what the status is. We can see here, when you see the very light kind of khaki colored states, from peeking over at the website, which I don't think those colors made it into our slide, those are the places where there are minimal, where there are no laws providing LGBT inclusive insurance protections. Versus, say, the stars, which are going to be your gold standard states, where they have, where they explicitly prohibit you from excluding trans people in your coverage. So, for example, Maryland, I'm not quite sure why it's light. They're probably defining things weird. Maryland is a star state. We do, as we'll talk about in a minute on a later slide, we do have some pretty good protections for trans people, specifically when it comes to healthcare provisions and healthcare insurance. I'll mention Arkansas specifically. I actually had to, unfortunately, speak with someone who was out in Arkansas recently, and they actually explicitly have laws permitting people to discriminate, permitting insurance companies to discriminate against trans people. So there are some, so this is a very kind of scattershot map as to where people are. I believe it's something like 40% of trans people live in a state without protections. And on the next slide, some of the examples that we wanted to mention regarding those or the lack of protections in a lot of states. The laws, or 2021 has seen something of a push in anti-trans laws from state legislatures. Generally speaking, there are four big categories of things that these types of laws have been falling into. The first is youth healthcare bans, which are essentially laws which are trying to prohibit trans youth from obtaining gender affirming care. And in a lot of ways, in a lot of times, those laws are written in such a way that the language is so broad that even simply affirming a kid's gender by letting them wear the clothes that they want to or keep the hair length that they want to could theoretically violate these laws. And then on top of that, some youth take puberty blockers in order to delay puberty so that once they reach a slightly older age, they're able to make the decision to go onto hormone replacement therapy or take other actions if they want. Those are treatments that are being put at risk by these laws. In Texas, they've invented their own category for this, where they have passed a law. I'm not sure if it's been signed by the governor yet, where essentially if a parent is affirming of their trans kid, the law is going to define that as child abuse, and they're actually going to start taking trans kids away from their parents. There's currently a case up in the Supreme Court, Philadelphia versus Fulton, where they're discussing if a city or state government can discriminate against religious-based, when I say discriminate against, I mean not give contracts to religious-based adoption agencies, which are enforcing things like the kids who are here aren't allowed to be gay, and we're not giving them to gay parents or gay affirming parents. And so those two things can kind of collide together to make a rather poor situation where we're having trans kids taken away from parents and given to families that are going to, say, support conversion therapy. The other two sets of laws are sports bans, which a lot of states have been looking into those laws. I know a number of them were vetoed by governors this year. And so at this point, it's just a matter of how many governors are going to keep vetoing it, and will that keep happening before the momentum for the bills dies out. I believe the worst of those, or one of the most publicized of those, was Florida's law, which essentially, if someone challenges the gender of a child on the other team, then they actually have mandated genital inspections of the children. And finally, the last category is something that we touched on briefly in the last slide, which is that legalized medical discrimination of trans individuals, which can take place in a variety of forms, both insurance-wise or with regards to physicians just opting not to treat trans patients. The good news on the next slide is Maryland, as I mentioned, is pretty protected. We have two major laws that we, at the very least, need to be aware of, or the trans community should be aware of. The first one is relatively new. This was an insurance law from 2020. This protects people from discrimination by health insurance providers, where gender identity and sexual orientation were added into the protective laws. So essentially, as of October 2020, insurance providers aren't allowed to have blanket policies which say, we do not cover trans people. You'd be surprised how many localities and employers had insurance policies which had like paragraph 12 or whatever, we do not cover transition related services. And then trans people were just out of pocket, or they had to go find some private insurance not through their employer in order to cover transition related care. And the other major law that we should be concerned about, or that we should be aware of at least, is non-discrimination by healthcare providers. So a healthcare provider can't turn you away from a hospital because you're trans, or because you're gay or lesbian or bi, or anything on the LGBTQ plus spectrum, essentially. A doctor can't use that as an excuse to not treat a person. And I believe with that, Ezra is going to take us through a bit of a summary, and then we should be able to open it up for questions.
Right. Yes, that is exactly what I'm going to do. And I'm amazed at how fast we are flying by this, because you honestly never know how much we will talk. We obviously want to make sure that y'all get any questions answered, or any resources that you'd like, we can obviously look up for you or send to you in the chat. So please do ask any questions that you have. And so I promised earlier that I would share some positive experiences as well. This is from the LGBTQ Southern Health Survey that was shared earlier, just so we can get an idea of what affirming healthcare looks like, what it looks like when no discrimination is happening. And so you will see here I'm going to read a couple of them, not all of them, but upon visiting a new provider's office, the staff noted that I identified as LGBTQ+ and that I had a partner. Since returning for visits, I'm asked about my partner and how I'm doing. Clear investment in patients, treating them as human beings. It all sounds like, very basic, simple stuff. And in my opinion, it is, but oftentimes is not always so simple or as, common for everyone. One person came out to their psychiatrist as non-binary, and he was already familiar with the gender spectrum and aspects of transition, which made things a lot easier. You don't have to know every single thing about the LGBTQ+ community or about being trans or anything like that. But being able to educate yourself and to have some sort of knowledge so that the onus is not put upon, for example, the trans or non-binary person to educate the provider is incredibly important. I know for me, when I first went to seek hormone replacement therapy, my provider was new in terms of prescribing hormones to trans folks, but I could clearly tell she was doing research. She had to consult another physician at the time just to make sure she was telling me all the right information, but she clearly was very much interested and passionate and wanted to learn more and wanted to give me the best care. So even though she didn't know every single thing about hormone replacement therapy, she clearly showed care for me and was willing to learn more. So it was incredibly important, and was very lucky to have her as a provider. Seeing other images of LGBTQ+ people in reading material or in the waiting room, on the walls as posters, having trans pride flags, whatever it is, all of that imagery is super important. And again, it's something that is oftentimes overlooked or not seen as important or not seen as a big deal, but I promise you it really is. Being able to see yourself and know that you are supported here. You're not the weird trans person coming here for care, or, the only one who has ever been here. And again, using my own experience to add to this, I remember when I saw in my one provider's office, there was a sign about pap smears, and it said, "Men get pap smears too," and had a bunch of trans men on it. And it was just really nice to see that. It's just a very simple thing, but it made me immediately feel much more comfortable being in that office. And then finally, somebody talked about their OB not assuming their gender or the gender of their partners, asked straightforward questions, and knew which STI testing I needed without asking unnecessary questions. So again, having that knowledge in the background, also just having a space of no judgment, of just being there to listen to what a patient needs, and providing it. Again, super simple things that are oftentimes not seen as a big deal or overlooked in general. Really important. And this is actually from a different publication. This is not from the one survey. This is from Outfront. You see the source at the bottom. This was indirectly talking about Trans Day of Visibility, and it was trans people shared their stories and positive experiences. And so this is from last year as well. And this is just some more examples of what, again, affirming healthcare can look like. So again, talking about medical screenings are important. Having a no judgment realm is very important. And never feeling less than. I love that. I've never felt less than with her because of who I am. And then another person talking about dealing with something that's called dead naming and misgendering. If you don't know what dead naming is, it basically means referring to a trans or non-binary person's former name. So for me, it would be like using the name that I was, that my parents named me that I no longer use. If you were to use that name, that would be called dead naming me because it's not my name anymore. So, working with, talking to a doctor if, for example, maybe receptionists or other admin folks have maybe your legal name is still your old name or your dead name, and maybe they're using that, not realizing that what your name you actually go by. This person was able to talk to the doctor and say, "Oh no, this is happening. Can you help with this?" And they jumped right in and just talked to folks about it and got that changed. And then finally, just talking about again, a therapist who has been educated, who takes the time to actually educate themselves about things, about queer identities in this particular scenario. And if you are in healthcare or really want to, or if you really want to just, give an example to your healthcare provider, if they're not doing things such as intake forms or just, first time visit forms very well, this is just one example. It's by no means a perfect example, but I like to share it. And you see it's from a place called Trans Hub right there. So I like this one because it gives a bunch of different things as an example. So you'll see they have a space for title, and it's not just Miss, Ms, or Mrs. or Mr. It's not just that. You also see mix there, MX, which is something that some folks like to use. Some, for example, non-binary folks will use that. You also see Dr. NA or other too. I like how open this template is in a lot of ways. So again, like with the gender portion, you see there's female, male, non-binary, different identity, and then there's a space where somebody could specify it. You see same also with pronouns too. And one thing I really particularly love is the optional space where it says I use different words to describe my body. And so for some folks, maybe using the correct, or, not correct, but using certain anatomical words to describe, for example, genitals, might make people feel uncomfortable. So just specifying what words people like to be used in describing their body, I think that's really, really important and oftentimes is overlooked in my experience. And you also see here, because obviously healthcare providers need to collect your legal information, whether, getting a scanned copy of your driver's license and health insurance card. And so one thing I like that this form shows is that there's this part at the bottom, it says gender listed with Medicare in this example. And so that is to be, different than how they list gender above. So it's really trying to capture that legal portion so that things are billed correctly, that there are no denials that happen because of what insurance is sometimes called like a mismatch of gender. And so it allows for them to collect that legal information, but also respect the person filling it out. So that's just one example for y'all to think about or maybe advocate for. Another one resource that we wanted to share with y'all is Human Rights Campaign. They are also a pretty big organization in DC. They do every year now what's called the Healthcare Equality Index. I think they've been doing it for about 13 years now, so it definitely has been growing and growing. I believe they've done more than in this one in HEI 2020. They evaluated more than 1,700 healthcare facilities nationwide, basically determining what healthcare facilities policies and procedures are and whether or not they're LGBTQ+ affirming. And so it's great for various reasons. You can use it to look at different facilities in your area and see how well they did or didn't do. That's one way. It can also be used as a way to show maybe your own healthcare provider to say, hey, here's some recommendations that I think y'all should be doing to kind of give them a nudge to adopt better policies and procedures. I will also say that if you go and look up and go to the webpage that has HRC's Healthcare Equality Index, that there are also a bunch of resources on there. They have basically a place where you can look up different providers. They have know your rights sections. I believe they also have them state specific as well if you're interested. But they have a bunch of different resources on there that I definitely recommend you check out as well if you are either struggling to find a provider or are struggling with something related to healthcare, there may very well be something on there to help with that. And speaking of different help in general, this is for legal matters or insurance denials, things like that. Of course, we have to talk about us. So you can always request legal help from us. So that link right there is just our website. It might not be fully updated with all of the matters that are listed here, but it will be very shortly. Currently, we are accepting intakes on these matters here. You see name and gender marker changes, employment discrimination, healthcare discrimination, and advanced directives. And again, just a reminder on what we do, the employment and healthcare discrimination ones, it has to be due to LGBTQ+ status in some way. It can't be related to something else. It has to do with something related to your sexual orientation or gender identity. So you can always reach out to us. You could always fill it out as well and add in the notes. Maybe you just want to chat with an attorney briefly and just kind of talk about your situation, gather resources, or you can have a more formal intake and get connected with an attorney to help with, for example, for a name change, filing, court paperwork. So there are different options there when reaching out to us. And then one other resource that's specific to insurance and healthcare in general is called Healthy Trans, and I believe what website is just healthytrans.com. Very simple. And they are great because they have a bunch of different resources, including one with insurance assistance. There's a big there's this very intimidating looking diagram that exists on there that is very fascinating to look at, that it's meant for you to give to your healthcare provider. Let's say if you are denied affirming care for something, there's like a whole flow chart of like, here's what the healthcare provider needs to do on their end if you get denied for something that should be covered. It takes this step-by-step, exactly, different codes that medical providers can use to help with this, to appeal it. They just have a bunch of different resources on there as well, in particular with insurance that I would definitely recommend. And of course, if you're just simply interested in, learning about what are the current standards of care for trans patients, these are the two biggest standards of care, at least in the US. WPATH, the first one there, the World Professional Association for Trans Health. It is a more global standard of care. It is probably the most used here in the US. And there's the other one from UCSF down there. That's primary care protocol that's also used. I will say that I believe they are in the process, WPATH is in the process of updating their standards of care. I think they were overdue, and I believe the pandemic delayed that, as it delayed everything. So I'm not shocked by that. So I will say there are probably some things in that version that currently exist that are out of date, but hopefully they're getting together and are updating that this year sometime. And when it is updated, you can access it on their website directly. You can download a PDF in a variety of languages there. So if you're curious about what they currently recommend, check that out. And that, I believe, is everything that we had today. And so we have plenty of time if anyone has any questions. But I also just want to say, you see our email addresses down there. You can also reach out after this if you want to follow up with something that we talked about, or if you want help finding a resource when it comes to healthcare, or just wanting to know if we had heard about a certain provider, or whether or not we could connect them with somebody there to talk about potentially joining them. Let us know. We're happy to help. And if we can't help, if we're not the folks that can help you with something, we can put you in contact with somebody who can. So we're always super happy to help. And also just want to say thanks again for joining on a Monday evening. And so now I'm going to be quiet for a second and see if y'all have any questions. If you do, put them in the chat. We can hang about for a few minutes and see if there are any questions.
Yeah, also if anybody wants to speak to ask the question instead of typing it out, you can raise your hand and I'll allow you to unmute your mic as well. I have questions that I could ask, of course, but I really want to make sure that anybody attending can ask any questions regardless of what your connection is to the trans community, LGBT community, healthcare community. So gonna see if anyone wants to jump on that. Well, if anybody else is thinking, go ask away. But I wanted to ask, in the wake of all of these horrible, anti-trans legislative actions being thankfully not here where I live, but especially devastating for youth across the country, is there any, I don't know, I haven't been following it too closely, to be honest, because it's just so difficult to deal with emotionally as a trans person, even if I'm not being personally affected. So I'm not sure if there is a lot of like nationwide sort of effort of like, how can we kind of combat this and like try to protect people beyond just like raising awareness about these issues.
I don't know if you want to answer that, Mackenzie, or I can.
If you want to go and answer that, I'll take, it looks like we just got one in the chat. I'll take that one.
Yay. Awesome. I will say there has been the biggest momentum I've seen around recently, and Mackenzie, you can tell me if it's different for you, but I think the biggest thing that's come up recently has been talking about trans people and being banned in sports. And I think that while it's not 100% related to healthcare, I think it is related enough, in my personal opinion, to healthcare as it deals with physical activity and also things such as, Mackenzie was mentioning horrible things such as genital inspections to kids. And so I know a lot of the national organizations have been doing a lot of work in terms of trying to, on that bigger level, advocate for getting rid of those. So for example, Lambda Legal has been doing a bunch around this. I know NCT, National Center for Trans Equality, has been doing stuff as well. And so
ACLU's been doing a lot of litigation.
Yes, ACLU, yes, they have been doing a ton on this as well. So yes, there is a lot that's going on the national level. I think there also has been a focus on, more statewide, because I think, especially for states such as Arkansas that are dealing with quite negative laws going on right now. There's been a lot of focus support also from the national orgs to focus on states such as Arkansas to help with statewide policy. So it's kind of a mix of things. I would say it's going to be, I think it's going to be a battle for a bit for various things, for various reasons, but I'm hopeful some things will happen on the national level that will help some of those states that are currently, dealing with a lot more negative laws than we are here in Maryland. But again, I think it's going to be something that we'll be hearing about for a while, especially again, like sports bans. I think that's just been, for whatever reason, it became a hot topic very recently. So you will probably see, it'll probably be a bit, but there definitely are organized efforts happening, especially from, again, like Lambda Legal and ACLU have been doing a lot. So I would definitely check, especially those two orgs out. And then I'll let you go ahead, Mackenzie, for that next one.
Sure. And just to add on real quick, is one of the things that you see in a lot of these, when a lot of these things come up for votes, is you see pretty active mobilization on the ground at the local and state level, where a lot of times they just have to like find all of the trans kids, herd them into the state legislature and have them get up one by one and testify in front of all of their state Congress people. So there's definitely action going on. Something that I missed that I had a note that I forgot to read on one of the earlier slides is there was a recent Gallup poll that anti-trans laws are actually really unpopular. Even among like the Republican voter base, they only have like 30 to 40% support at most. So it's certainly something that's being done. As I tried to explain to someone once, it's when we say that cruelty is the point, people aren't doing this to please their voters. They're getting voters because they want to do this. And so it's not like there's a big mass movement among people. It's a very vocal minority. But moving on, because I've doubled the length of that answer. So one of the questions that we got was, are the other laws regarding the LGBTQ community that you are currently working on in the state of Maryland? So the Maryland session just ended, I believe, a few weeks ago. And we had a few laws that we were working on that we advocated for. Some got through, some didn't. It was a little bit weird of a session because of COVID, so we weren't in person advocating for these things. And on top of this, COVID relief and type bills ended up taking up a lot of the legislature's time. And the prior year, the 2019 session had gotten cut short, or the 2020 session was cut short by COVID. So we had to reintroduce all of these bills that we'd like been on the verge of passing. So some of the things that got through were we've worked to streamline the name and gender marker change process with the court system. If you're not aware, right now the requirement is that you have to publish your name change in a newspaper for 15 days unless the court waives it. And that whether or not the judges will waive that depends a lot by county. One of the things that the new law says is, I believe in October, that waiver of publication should be automatic. The transpanic defense was banned in Maryland this past session. There's another big one that I'm trying to think of but can't. A couple that we were trying to push through, there was some language about things like marriage certificates and just other places where people's names are. There weren't formal procedures to get those changed. That law, because it was rather new this year, kind of got ended up getting ground up in committee and is hopefully in a form that we can introduce it and pass it next year. There were also some educational related discrimination related bills where people were throwing out language about like religious schools can discriminate and private schools can discriminate and just kind of hashing things out on those areas. And so some of that didn't get all the way through.
All of that to say is that there's always, I feel like there's always something that we can do. And because, as Mackenzie said, this session was strange for various reasons. It just, honestly, it wasn't enough time to do everything. So I expect we will have a bunch of different things to do this upcoming session that honestly we will probably start planning very soon. And then probably by the end of the summer, at the very least. And then I see somebody said, are new doctors coming out of med schools with more LGBTQ plus awareness training? I would say it depends. I would say somewhat. I do think it is getting better. And so here's why I say somewhat is because I think it is becoming a lot more common. The positive thing, it is becoming a lot more common. There is at least something or at least multiple things that are implemented in different med school programs to talk about the LGBTQ plus community in particular and give actual examples of some of the medical things that concern our community and things like that. It is getting better. However, I think, and this happens, I think, with a bunch of different social identities as well, is that sometimes it becomes where the LGBTQ plus awareness training is just one little like session where it's like, we're going to talk about it for like an hour and you will now know everything about the LGBTQ plus community. Now treat everyone. So it's a little bit, we're getting there, but it's still, I think what you can probably tell from, even just talking today is that there are a lot of different things. LGBTQ plus community includes so many different people with many different experiences. And again, if we're even just talking about the trans community, there are so many different experiences when it comes to healthcare within that. My experience with healthcare as a trans person is incredibly different from the next person's. And so we could talk for days about different scenarios or different access to healthcare. So when there is just one type of segment or one type of training, you only get a teeny tiny little taste of the entire community. And so there's definitely more that can be done. But I do think, I really am optimistic. I do think we are moving in the direction where we will have more.
And I do think that there are more doctors that are either interested in, I'll say specifically, trans-related care, then there were like 10 or 15 years ago. One of the other issues that we often have, like with WPATH needing to be updated, is some of the medical knowledge is certainly lacking. I've sometimes joked that Reddit is the greatest repository of transition-related knowledge, or of transition-related medical knowledge, just because of a lack of long-term studies. Not that there aren't, but as we get more of those and as they become more readily available for doctors, and as places like Planned Parenthood continue to grow their gender affirming practices, I think we are seeing a growing number of doctors who have some experience, even if you do have to seek them out still.
Thank you. It is just about 8 o'clock. I'm sure people are ready to relax at the end of the night. I did post a link to our feedback form for all of our classes through HCLS. So if any attendees could fill that out just for a few minutes, that would be appreciated. I'm also going to post the link to our next next presentation in this series that will be focused on employment for the LGBTQ community. So check that out as well. Thank you for your great questions. This is certainly a topic that's near to my heart. So I'm glad that we could cover this. And like I said in the chat, this is being recorded. I don't know when the recording will finally be put up, but it will at some point in the future. So if you're interested in when that goes live, then check back on our YouTube channel that can be found through our website, or you can reach out to me directly at ash.baker@hclibrary.org. And with that, is there any final remarks you want to make before we close this out?
I just want to say thank y'all at HCLS for having us again, and we're super excited to do the next one coming next month. And thank you all again for attending and for all your great questions. Again, feel free to reach out to either one of us at any point if we can be helpful.